Okay, hello everybody and welcome. Thank you all so much for joining us. We're going to go ahead and get started now. Okay, great. The title of our webinar today is Preparing for the Spring Allergy Season. My name is Rebecca Russell. I am a patient education specialist with PMD Healthcare, and today we have a very special speaker with us who will be talking to you about how to prepare for the spring allergy season. We have Carol Jones. She is an RN and also a certified asthma educator, as well as a consultant for the Allergy Asthma Network Mothers of Asthmatics. Carol, thank you so much for joining us. Welcome.
Thank you, Rebecca. With spring and summer around the corner, we're going to talk today about seasonal allergies and how they relate to asthma symptoms. 85% of patients with asthma have allergies. 65% of people with severe asthma also have sinusitis, so you can see those numbers are pretty large. Allergen exposure is associated with the following: an increased risk of developing asthma, increased asthma-related conditions such as allergic rhinitis, sinusitis, gastroesophageal reflux disease, and so forth, and more severe persistent asthma. However, allergen avoidance can reduce airway reactivity and asthma-related conditions in allergic patients. Now, I'd like to show you how the allergy and asthma are connected. If you look at this diagram of the upper and lower airways, you'll see you breathe in the allergens such as tree pollens in through the nasal cavity, and if allergic to the pollens and left untreated, it can lead to allergic rhinitis, sinusitis, and cause asthma symptoms. Allergic rhinitis occurs when your immune system overreacts to allergens in the air you breathe in and are allergic to. So there's mast cells in your nasal passages, and when you breathe in those allergens, they react and cause all the symptoms that you have with allergic rhinitis. Now, if your sinuses become congested, you feel a headache on the forehead between your eyes, and that's called the frontal sinuses, or pressure in your cheeks, which is the maxillary sinuses. And those are the sinuses that you will most frequently have a problem with. Whether or not you're likely to develop allergies is often passed down through families. If both parents have allergies, you will most likely have allergies, especially if your mother is allergic. The mother seems to carry the most weight there. So you can clearly see how the upper and lower airways connect. Now, next we're going to talk about the EPR guidelines for asthma management. The National Institute of Health instituted guidelines to direct asthma care, and there are 6 main messages that direct this care. First of all, inhaled corticosteroids are the first line of treatment to treat that inflammation in the airways. A peak expiratory flow rate is what you're going to monitor your asthma with, and severe asthma attacks. And these are used most often for people with persistent asthma or people that do have frequent or severe asthma exacerbations. Monitor your severity according to the current symptoms, so it can change over time. You can go from mild to severe or moderate, but it's actually monitored by the severity that's going on right at that time within your lungs. Written asthma action plan, and everyone with asthma should get a written asthma action plan from your provider detailing your symptoms, peak flow, medication, and when to call your healthcare provider. And this plan should be updated at every visit, so make sure that's done when you go for a visit. Now, the 5th one is regular scheduled and planned follow-up visits. Schedule visits even when you're well to keep asthma under control. And I know that's hard because it's hard to conceive of going to the doctor when you're feeling well, but that's going to help you maintain that control. And lastly, the allergen and irritant avoidance measures to avoid potential asthma symptoms, and that's a lot about what we're going to talk about today. Okay, the next thing we're going to talk about is those outdoor allergens and what those seasonal allergies are, what our triggers are. Well, we have trees in early spring, And that's what we're, if you're not feeling it already, and the West Coast certainly might be, you will soon be feeling that, especially with all the warm weather that we've been having. Grasses occur in late spring and summer. Dry molds in summer and fall. But I should mention that you might also encounter molds as you have those wet leaves on the ground that you're going to be trying to get rid of. And then, of course, the weeds in late summer and fall, and that's when we get into what's called ragweed season, okay? Now, the symptoms that you may feel is sneezing, often with a runny or congested nose, coughing, and postnasal drip. And that postnasal drip can often cause a cough, especially in the early morning, and also a scratchy throat. So if you wake up and you have that cough in the early morning or scratchy throat, it can be from the allergic rhinitis, or it could be a postnasal drip from your sinuses as well. Itchy eyes, nose, and throat. And dark circles under your eyes is always a telltale sign that there's allergy going on. Now, you all are probably familiar with the allergic salute. You will see a crease at the top of the nose that is created by the person frequently rubbing that itchy, runny nose upward. So if you see someone with a crease, you're walking down the street and see somebody with a crease on their upper nose, suspect they might have allergies. Okay, the next thing is the outdoor allergens and how we're going to find out when they exist and what to do about them. The pollen counts are geographic, as you can imagine. Like I said, right now, probably on the West Coast, they're having more allergies than we are on the East Coast. There's two places you can go to and check your pollen count in your area. And one is the National Allergy Bureau, and there's the phone number. The other one is pollen.quadai.org, and that you go to, you'll see a map of the United States, and you can click on your area to see exactly what's going on in your particular area. Now, air conditioning, it's a good idea to have air conditioning. It keeps the pollen out, and it also cleans and dries the air. Avoid fans in the window, and if you don't have air conditioning, I know a lot of people, including myself and way back, put fans in the window so you can keep cooler, but that just gets all that pollen in the air in your home. So you want to be sure to take your medications regularly so you don't feel sick with doing that. Change car air filter regularly. Shower and shampoo after working and playing outdoors. The pollen that's in the air is sticky, and it sticks to your hair and your clothes. So that's why it's important to do that when you get in the house. So at nighttime, you're not sleeping in, that your hair with all the pollen in your hair. Avoid yard cleanup in spring or wear a mask. The last one being dry clothing in the dryer, not outdoors. And nothing smells better than those fresh sheets that are dried outside. But if you think about it, it's picked up all that sticky pollen and you put it on your bed and then you go to bed at night. So try to avoid drying the clothes outside. Now the next one is seasonal pre-medicating. And we're going to talk about what's typically prescribed. The inhaled corticosteroid nasal spray is the first line of treatment. But start early, pre-season, if you know you have a diagnosed seasonal allergy. We don't want you to wait until your symptoms occur, because then it can get ahead of you and you can get sick and then ultimately asthma problems. And discuss with your healthcare provider what would be best for you. And I'm going to list all the medications that you might possibly take, but again, discuss this with your healthcare provider because it is an individual thing. So there are oral and nasal antihistamine sprays. And the antihistamine nasal sprays actually block that mast cell in the nose, that immune allergic reaction that causes all your symptoms. So that can be a really good either add-on to the steroid spray, or it can, stand alone. Again, it's up to you and your provider what you need. Now, the nasal decongestant spray And I put in there no more than 3 days. And I say that because we can get a lot of relief from the over-the-counter nasal decongestant sprays, but you don't want to use them more than 3-5 days at the most unless directed by your provider. Using too long can cause rebound congestion and make that nasal congestion much worse. And it's really hard to treat. It's hard to get rid of that. There are what we call the leukotriene modifiers, and Singular is the one that is available. And what that does is block the leukotriene inflammatory cells that are also causing allergic reactions. And patients with asthma who have an allergic component often find relief with that. And again, we're back to that avoidance of allergens and irritants and pollutants. And I want to talk about other treatments. There's allergy shots. There's Xolair. Both of those are injections, weekly injections. But again, those are only used when everything else has failed and you continue to have frequent asthma exacerbations. Now, I put in here the recipe for the saline nasal wash, and it's a cup of distilled water, a half teaspoon of kosher salt, and a pinch of baking soda. And I want to stress, do use distilled water, do not use tap water, okay? Because that bacteria from the tap water can get up in your nasal passages and sinuses and so forth and do a lot of damage. Okay, so what about outdoor exercising and sports? Because a lot of people think, well, I can't go out now because, you know, I'm allergic to pollens and I don't feel good and so on and so forth. Well, 90% of patients with asthma report exercise as a trigger, and your quality of life is extremely important. So here again, we would like for you to pre-medicate at the beginning of the season if you know you have seasonal allergies. And again, that diagnosis of an exercise-induced bronchospasm should be diagnosed by a specialist and treated accordingly. Now, symptoms you can have with that is the symptoms may be accelerated with the season because of the pollens. Cough, wheeze, chest tightness or shortness of breath. Chest pain, and this is especially in children when they run and play. Feeling out of shape when actually you're in good condition. And fatigue. Okay, so what can we do before we go outside to do our exercise and sports and so forth? Well, take a short-acting bronchodilator 5 to 20 minutes prior to exercise. Warm up and cool down, at least 5 minutes, 10 minutes if you can before you go outside and exercise. Cover your mouth if exposed to cold, dry air. And if you're covering your mouth with the cold air with a scarf, it keeps that moist air in your upper respiratory tract and helps you avoid exercise-induced bronchospasms. And again, limit exposure to seasonal allergies. Now, if you normally exercise 30 to 60 minutes, cut back on your time to reduce the exposure to the allergens. But do try to get out there and be healthy. And of course, I didn't mention the ozone, but avoid going out on high ozone days. So, I hope this helps you enjoy your spring and summer. And thank you. Some pollutants. And I want to talk about other treatments. There's allergy shots. There's Xolair. Both of those are injections, weekly injections. But again, those are only used when everything else has failed and you continue to have frequent asthma exacerbations. Now, I put in here the recipe for the saline nasal wash. And it's a cup of distilled water, a half teaspoon of kosher salt, and a pinch of baking soda. And I want to stress, do use distilled water, do not use tap water, okay? Because that bacteria from the tap water can get up in your nasal passages and sinuses and so forth and do a lot of damage. Okay, so what about outdoor exercising and sports? Because a lot of people think, well, I can't go out now because, you know, I'm allergic to pollens and I don't feel good and so on and so forth. Well, 90% of patients with asthma report exercise as a trigger, and your quality of life is extremely important. So here again, we would like for you to pre-medicate at the beginning of the season if you know you have seasonal allergies. And again, that diagnosis of an exercise-induced bronchospasm should be diagnosed by a specialist and treated accordingly. Now, symptoms you can have with that is the symptoms may be accelerated with the season because of the pollens. Cough, wheeze, chest tightness or shortness of breath. chest pain, and this is especially in children when they run and play, feeling out of shape when actually you're in good condition, and fatigue. Okay, so what can we do before we go outside to do our exercise and sports and so forth? Well, take a short-acting bronchodilator 5 to 20 minutes prior to exercise. Warm up and cool down, at least 5 minutes, 10 minutes if you can before you go outside and exercise. Cover your mouth if exposed to cold, dry air. And if you're covering your mouth with the cold air with a scarf, it keeps that moist air in your upper respiratory tract and helps you avoid exercise-induced bronchospasms. And again, limit exposure to seasonal allergies. Now, if you normally exercise 30 to 60 minutes, cut back on your time to reduce the exposure to the allergens. But do try to get out there and be healthy. And of course, I didn't mention the ozone, but avoid going out on high ozone days. So I hope this helps you enjoy your spring and summer, and thank you.
Okay, great. We also want to talk to you about Spiro PD. Spiro PD is truly the world's first personal spirometer. It empowers people who have asthma and also some other lung conditions to monitor their lung function anytime and anywhere. So whether you're at home or work or school, or maybe you're thinking about going out on a day where allergies may be high, you can monitor your lung function and understand the severity of your condition right at a glance. So you can also, with Spiro PD, see if you're having a decline in your lung function before ever even feeling symptoms. This will help you anticipate and prevent exacerbations and asthma attacks, which will ultimately reduce expensive trips to the ER. It also allows you to track your trends. So it lets you and your healthcare provider know if the treatment is working and if your dosage is correct. You'll be able to see at a glance if you're responding to your treatments. It helps you remember as well. Spiro PD has a medication manager that's built right into the device, so you can set alarms to remind yourself when it's time to take your medication, to perform a breathing exercise, or to test your lung function. Spiro PD also helps you improve communication with your doctor. You can very easily share the reports with your doctor. All that you have to do is plug a USB cable into your device and then into your computer, and you'll be able to quickly and easily upload the information and then shoot your doctor an email if you'd like. It's also extremely easy to use. It has intuitive software. It has a color touchscreen. It has 2 soft and squeezable handles, which will help you breathe out really hard when doing the lung function test. The 2 handles helps you open up your chest cavity. It has a respiratory therapist that's literally built right into the device. By this I mean there is an audible voice which will come on and coach you throughout the entire process. And then the front of the device has these little blue LED lights, or there's 7 of them, and the goal is to light all 7 of them as you're exhaling to help you force all that air out of your lungs. So we can leave you with a quote. This is by Dr. Michael Blaze. And Dr. Blaze states that with the increased prevalence of emergency department visits and hospitalizations for asthma and other pulmonary problems in the U.S., Spiro PD can empower patients to monitor their disease and catch problems before they lead to that costly emergency room visit. So we want to thank you, Carol, again for coming and teaching us about how to prepare for the spring allergy season. If you have any questions, don't hesitate to give us a call at 888-PMD-FOR-YOU or visit us at spiropd.com, Facebook, or Twitter. So thank you very much. If you have any questions, again, feel free to enter them in the Q&A box. And we hope to see you all again in the future. Have a great day. Bye-bye.